You're back in the parking lot, Kevin. Oh, good effort. How's it going, Jackie? And Ken?
Oh, pretty good. How about you?
Oh, yeah, same as everyone else.
Hi, Ray.
Hello, everybody.
I'm shadowed. I can see I'm shadowed. Oh, well.
I'm just blurred.
Blurry.
My computer's too old to blur my background. It won't do it.
Yeah, it's a new app since I came on. I was on Zoom 2 nights ago for the youth committee, and I had to update all of my Zoom. They had all sorts of new additions. So one of them was give me the option of blur. It says blur background, but it didn't say anything about blur face. That might have been a better option.
There is, you could totally do like a filter for your skin on Zoom. Isn't that terrifying?
Can you really?
Yeah, you can get rid of all your watches stuff and do a like filter. It's hilarious.
Really? Will it add hair?
Yeah. Are you looking into that now, Ken?
You saw the one where you could be a cat, right, Ken?
Yeah, I didn't like that one.
That was amazing.
That was pretty funny.
Not like that one.
Kathy, you're muted. We can't hear you.
Can you hear me now?
Now we can. Yeah.
Sorry, Chambers was muted. I said, I can't believe you're letting Wes and I sit here all by ourselves.
Well, I was trying to come in, but I got delayed. Just due to some personal things, so I couldn't get down there in time. So I thought I better log in.
Is Sheena on?
Yeah.
Make this bigger. Okay. 1 minute and then we'll get going. All right, it's 2:00. Call the meeting to order, special council meeting for September 3rd, 2021. Call it to order. Attendance at the start of the meeting is 100% with Councillor Broadhead and Mayor Herron in Chambers and the rest on Zoom. Can I have a motion to adopt the agenda?
I'll do it. That the September.
Hey, Ken, you're not here. Wes gets to do it.
Go ahead, Wes. If you want to take what little power I have, go ahead.
Well, I move that the September 3rd, 2021 special city council meeting agenda be adopted as presented.
Hey, thank you. All those in favor? I'm seeing that's unanimous. Are you wanting us to vote on Granicus? Pardon? You done it for us? Okay. All right. Okay, really, we had 2 people registered to speak, Ms. Cote, and then there was someone else. Are they here?
Yeah, we're just checking in. It doesn't look like they're in the Zoom meeting. We do have somebody by the name of Mr. McMillan, but we're not sure who that is. It might be the individual wishing to speak with.
You have a Mr. McMillan on the
Zoom call.
Well, he had registered to speak.
Yep, Robert McMillan, yes, he's on.
Okay. Mr. McMillan, can you hear me? I don't see him.
He's not on now.
No, okay.
Yeah.
All right. So no presentations. We'll go right to the one and only business item on the agenda, which is 4.1 COVID-19 update with Percy. Percy, I do see that Vern's online. Do you want to introduce him?
Vern's just here to just in case a question comes up.
Just but because he's new, I thought you might want to introduce him.
Okay.
Yeah.
Vern, if you turn your camera on, Vern Elliott is one of the deputy. He's deputy chief, and he's been acting as fire chief or director of emergency services.
Thank you. All right. Thanks for joining us. Okay, so go ahead, Percy.
You bet. I'm going to share my screen here, and hopefully I get I should get the right screen here and get that. We've got a bit of a presentation for you and that sort of thing with the COVID update. So
the question was this update pre 11:30 this morning or post 11:30 this morning?
A little bit of both. So there's some context from previous, and there's some context from after as well. So
thanks for updating it.
You bet. So really, one thing I'd like to also do is additionally introduce Dr. Christopher Sikora, who is lead medical officer of health for the Edmonton zone. He's joining us here for this presentation today as well, and he'll be able to answer questions you may have after we complete this update. And the update itself really will include provincial, regional, local information, plus administration's response with staff, to COVID. So really, from the since the province launched the Open for Summer plan, the active case count has seen a steady rise as public health measures were reduced. The province currently has 12,686 active COVID-19 cases. This is up significantly from July 13th case count of 569 active cases. 82.4% or 10,449 of those active cases are identified as variant cases, and the vast majority of those are Delta variant. Alberta currently has the highest active case count in the country. It's higher than the total of the next two active case counts for BC, which is 6,270, and Ontario, which is 6,031 combined. And it's more than 1/3 of the national active case total of 33,493. It's not surprising, Alberta also has the nation's highest provincial and territorial rates of active cases at 291 per 100,000. Of Alberta's reported active cases from August 26th to September 1st, the majority of those active cases are in the 20 to 39-year-old range. There are currently 487 individuals hospitalized, of which 114 are ICU patients. And really, what do those numbers mean? The Alberta Health data indicates that COVID patients account for 5.6% of all non-ICU beds in the province. For ICU space, COVID patients account for 52.5% of cases. Non-COVID patients account for 38.6%, and unoccupied beds sit at 8.9% of the capacity. ICU-based COVID patients have resulted in surgical delays, and more were announced today in the provincial press conference. Alberta Health has also indicated that of COVID ICU patients between June 1st and September 1st, 87% were unvaccinated, 7% were partially vaccinated, and 6% were fully vaccinated. And during this time frame, for August 16th to the 22nd, the The provincial R value was 1.9. The Edmonton zone was 1.32. The Calgary zone was 1.05, and the rest of Alberta was at 1.22. R values greater than 1 indicate that the transmission rate is increasing. This is where things are changing, obviously, and the province of Alberta and residents of St. Albert have experienced shifting public health orders in response to COVID-19 since March of 2020. The province entered stage 3 of Open for Summer on July 1st, which further eased restrictions implemented during the COVID's third wave as vaccinations increased and active case counts and hospitalizations decreased. In July, the province began to experience increasing active COVID-19 case counts and paused stage 3 for 6 weeks to assess until September 27th. And today, the province announced additional measures. Obviously, there were some masking orders in effect currently that were required for public health care facilities and also for public transit, rideshare, and taxis. Also, there were some isolation or quarantine requirements for COVID-19 symptoms or testing positive. Right now, the temporary public health measures that are being put in place effective September 4th at 8 a.m. Are in masking in all indoor indoor spaces and workplaces. Also, restaurants, cafes, pubs, nightclubs, and other licensed establishments will be required to end alcohol services at 10 p.m. There's also some recommendations that are in place with the province that they announced. Albertans are encouraged to limit in-person contacts and to support this, the province strongly recommends that unvaccinated Albertans limit their indoor social gatherings to close contacts of only 2 cohort families up to a maximum of 10 people. And it's also recommended that employers pause their plans to have staff return to work and instead continue with work from home measures. If employees are working on location, employees must mask for all indoor settings, except in workstation where 2-meter physical distancing or adequate physical barriers are in place. There is a bit of a challenge right now with these new measures as the orders are not in place yet. For our local and regional context, the Edmonton zone is similar to the province with increasing active case numbers. The Edmonton zone has the highest reported active case count for any zone of the province at 3,947. The median age by month of those affected by COVID-19 has been decreasing and is around 30 years of age. Like the province, most active cases are in the 20 to 39 year age range for our region. This has been the primary age group that has been affected with COVID-19 over the summer. Regionally, we have seen a difference in transmission locations since the beginning of January to the beginning of July. Transmission has switched from household acquisition to community-based acquisition of COVID-19. Data from January to the end of August had household transmission at 37.9% and community transmission at 33.4%. The data from July to the end of August now has community-based transmission at over 55% and households decreased to 16.6%. The increase in numbers attributed to community-based acquisition has been consistent in August as well. Additionally, there has been an increased number of outbreaks in the regions. Outbreaks are reported when healthcare facilities have 2 or more cases, correctional facilities, shelters, or community childcare facilities when 5 or more cases occur, and non-healthcare workplaces when 10 or more places occur. Currently, there are no outbreaks in St. Albert. Around the zone, active case numbers vary, and that Edmonton currently has 2,691 active cases, or is at 259.2 per 100,000. Sherwood Park has 234 active cases, or is at 318.5 per 100,000. Spruce Grove is at 131 active cases, or 347.2 per 100,000. St. Albert itself is at 130 active cases, or 186.8 per 100,000. Sturgeon County is at 118 active cases, or 422.5 per 100,000. Leduc has 93 active cases, or 276.9 per 100,000. Beaumont has 81 active cases, or 423.2 per 100,000. And Fort Saskatchewan has 77 active cases, or 284.6 per 100,000. As mentioned, St. Albert has 130 active cases, which is up from a low of 1 case on July 15th. This value is 33.2% of the previous peak of 391 active cases. Also reported for St. Albert, 2,946 individuals have recovered, and 45 deaths have occurred from COVID-19. Vaccinations have been identified as an effective control to protect against COVID-19 virus. Yesterday, the province announced that we reached 70% of eligible Albertans 12 plus who have received that second dose of the vaccine. Since the province began reporting vaccination statistics, St. Albert has ranked amongst the highest percentage of vaccinated total population for municipalities or regions reported. For those eligible 12 plus, 86.1% have their first dose, and when I obviously messed up on my numbers here, and 81.1% are fully vaccinated. While great news, this also means of the 60,363 eligible residents that are Alberta Health identifies from St. Albert, 8,362 have not had their first dose, and 11,389 have not had their second dose. Vaccination rates have diminished across the province and also within St. Albert. And that 7-day moving average for vaccination in St. Albert is around 94, 34 of which are first doses and 60 are second doses. There is over a 90% uptake for first and second dose vaccinations for those over 60. And the age group with the lowest uptake in vaccination is that 20 to 39-year-old, with 75.9% first dose uptake and 68% uptake for full vaccination. There's been a whole bunch of things going around, as you're well aware of, in terms of other councils doing different things related, and municipalities doing things related to face coverings or other pieces. The City of Edmonton's council voted to implement a face covering bylaw that came in effect today. Strathcona County Council voted to implement face coverings for all indoor spaces until December 31st as well, effective the 10th. And yesterday, Sturgeon County met and postponed their masking bylaw first reading until September 14th. Obviously, the province has implemented their mandatory measure here today, and that's kind of changes a little bit in terms of what's going on. But other municipalities had been having their staff required to wear face coverings. Calgary had individuals required staff and public to wear masking in all publicly owned and operated facilities. For mitigation strategies, employers have responsibilities under occupational health and safety to ensure safe workplaces for workers and others at and around the work site. COVID-19 is a recognized hazard that employers are required to address, including the changing conditions that occur related to COVID-19. Hazards are controlled under a hierarchy of administrative controls, including engineering controls and personal protective equipment. Administration has used a number of these measures for staff to address the situation. Engineered controls, such as increasing air exchanges, and physical barriers put in place, are utilized where possible. Administrative controls such as training, enhanced cleaning, hand washing stations, remote work when necessary and where possible, plus policies that address individual health screening, rapid response plan, and contact tracing are utilized and reinforced with signage. Personal protective equipment such as masks and, where necessary, gloves plus face shields and goggles are required and provided for staff. Vaccination has been identified by Provincial Occupational Health and Safety as an engineered control for COVID-19, and staff will be surveyed to identify vaccination levels to assess whether additional controls are necessary. And really that ends our update for today, and we really look forward to your questions.
All right. And I assume, Percy, that we can also direct our questions to Dr. Sikora.
Absolutely. That's why Dr. Sikora is here.
Perfect. Thank you. So, Dr. Sikora, thank you again for joining us. I have a feeling you have been in high demand over the last couple of days. I know you were scheduled to attend other municipal meetings as well. So we appreciate you taking the time. Although I don't know with the recent change, with a recent announcement, where the questions are going to go. I will ask council to be somewhat patient with Percy and Kevin, because although it was announced that masks would be required at all indoor public spaces today, of course, what needs to follow is an official order that Kevin and David do not have yet. So any questions might be met with a shrug. We don't know yet. So please be patient with him. So I'll just open it up. Who wants to go first? Councillor Hanson, go ahead.
Thanks so much for the presentation, Percy, and thanks for joining us, Dr. Sikora. I guess I think I heard you say, Percy, that where possible, meetings should be virtual. Not sure if I heard that right. So I'm just wondering, in terms of councils around, especially the Edmonton zone, where we appear to be in a higher R rate, whether the recommendation is for our council meetings and staff meetings to go back to back to virtual. Did I hear that right?
What we've done is that's a recommendation we've put in place for our staff. In terms of council meetings and that, I don't know if there is any direct provincial direction at this time specifically for that. Obviously, there are measures that are in place in council chambers, and business still has to transpire. Our council business still needs to continue. Mm-hmm. And maybe Dr. Sikora could add a little bit of information if he has heard anything else on that as well.
Yeah, I apologize. I don't have any further information on it. I think the general principle of trying to continue on the virtual work or the remote work is as much as possible, or at least as much as achievable for a particular business or a particular organization, is a good intent to be able to do. Certainly I think many organizations have sort of started to put on hold the return to the office planning that perhaps was being undertaken over, or at least for the month of September. But I'm sure there will be further development and direction provided by our partners at Alberta Health.
Okay, thanks for that. And I didn't expect that to be a clear direction. I just was kind of wondering where we were going. In terms of our own cases in St. Albert, Dr. Sikora, I'm not sure if Percy covered this. How for the cases that are active, do we know who's really sick and who's in ICU? Do we have a percentage of that? And would they all be at Sturgeon? Would they be all spread around? How's our Sturgeon Hospital doing? Do we have those outside of St. Albert? All those kinds of statistics to help us understand the level of, I guess, sickness of those active cases.
That's a great question, Councillor. What we do from a healthcare system response perspective is that we always consider our critical care resources, as in our ICU beds and then our inpatient beds, to be really regional resources. If somebody needs a bed and they happen to reside in Beaumont, well, they might go to any number of different facilities or any particular beds across the zone that are going to be most appropriate for them at that point in time. And then we're able to shuffle things around to be able to provide that service for our entire Northern Alberta population. Within our northern, well, Edmonton and area is somewhat of a catchment area for Northern Alberta, bits of BC, bits of Saskatchewan, and then our partners in the Northwest Territories as well. And so that we always do our best to be able to provide that resource, both from a base perspective, as in we do the regular things, but we also do those specialty environments or the specialty services like critical care for that larger population. I can't speak specifically to how many St. Albert residents are in a critical care environment or in an admitted bed. I just don't have that handy. So I apologize for that. What we do know is that we have individuals that require admission, that require critical care support. We're happy to be able to provide that service to them. It's needed. And what we're seeing much more of from our information, and Percy had really started to outline this, is that those that are admitted are predominantly under-immunized, either non-immunized or not fully immunized, or have not yet fully received the benefit of the immunization itself. And that's something that we have to continue to do. The other thing and the other factor that Percy outlined is we're seeing much more community spread. So individuals are acquiring COVID, not necessarily within that household to household transmission or transmission within a household environment, but by means of being out in the general public, doing the things that we've been able to do over the past month or so. It serves as a reminder of the importance of having really that full suite of interventions to be able to help limit and reduce the spread of COVID-19. Reduction of spread, reduction of transmission, reduction of acquisition is the big things that we're all working on. Immunization helps keep you safe and helps keep you from getting severely ill. It also likely reduces your likelihood of transmitting from person to person should you become infected. So that's one key intervention that is in that toolkit. Other things that are in that toolkit are the safe for work, safe for play, safe for learning approach. So at the start of every day, we've all become very familiar with identifying, do I have symptoms that are associated with COVID? Do I have fever, cough, shortness of breath? Have I lost sense of taste or smell? And if so, well, I probably shouldn't go to work, school, or that outdoor activity or that activity that I was initially planning, and I should get tested. So we've also become much more comfortable with the hand hygiene, using alcohol-based hand sanitizer, soap and water, and then the whole practice of not touching your eyes, your mouth, and your nose. very important things to help reduce transmission events overall. And what we've seen with the announcement this morning is that a return to masking, a very simple intervention that all of us are comfortable with, our populations are very comfortable with, and can be one added tool to help reduce transmission, most especially in that community environment. That mask serves, again, two purposes. You wear it, it filters the stuff that's coming in, which means you're less likely to be exposed to infected particles that are out in the environment from other people. And it also protects other individuals from you as a wearer. When you wear that mask, your own particles that you breathe out are filtered and caught in that mask, and you're thereby protecting other individuals as well. So we're trying to help reduce transmission events across our communities overall. I think that's a defined purpose of any of the policies that have been announced here today. Our cities have done amazing jobs in helping protect their public, helping protect their workers, and certainly being able to help encourage our citizens to be able to take those simple practices, become immunized and protected, stay home if you're sick, are all very important things that I know every one of our cities have done in spades over the past year. I think we still have to continue with it.
Well, thank you so much. And thank you for being here.
And I'm sorry, I probably went over time.
It's okay. Dr. Sikora, can you give us a kind of a sense of how the 12 and under population is being affected right now? I mean, we've heard, and I don't know where, I've heard rumors that there's at least a couple in hospital because they're under 12, not vaccinated. I'm just wondering if you're seeing any trends for that younger age group, because any municipal mask mandate that we would have considered prior to the announcement today would be very much to protect those younger kids. So I'm just wondering if you could give us a sense of how they are dealing with the Delta variant.
And thank you very much. We do have concern for our very young population as well. So they have not yet had the opportunity to receive the protective benefit of the immunizations yet. Health Canada, we're awaiting Health Canada to assess any applications that they receive to be able to expand that eligibility criteria in the under 12 population. So Alberta Health and alberta.ca does actually present all of the critical care and hospitalization data by age group over the 0 to 1, 1 to 4, 5 to 9, and then upwards from there. There are arguably lower numbers of hospitalizations and critical care admissions for the under 12 and under 19 population, and I don't believe Alberta has registered any deaths in that age group. That being said, they may also transmit, if they acquire illness, to other people, namely older adults, for instance, because kids like their grandparents and grandparents like their kids. So being able to have that consistent monitoring, utilizing those other suites, those other tools in that suite of tools, being the safe for work, the symptom monitoring, easy access to testing, isolation if you are a case, and then monitoring of any close contacts that may come from being in close vicinity to known COVID positive individuals. I know our schools have very robust mechanisms around ventilation, around environmental cleaning, around the daily symptom checks for both their workers as well as for the students themselves. Many school districts have elected to take extra measures, including masking as an extra tool to be able to help reduce transmission events overall. But they're all designed to be able to do that whole core aspect of reducing transmission events of COVID-19 overall. We'll very carefully, of course, continue to monitor the health of our young person population, along with our 20 to 29s and 30 and above, and strive to continue to provide the high quality health service that we have across the Edmonton zone.
Awesome. Councillor Broadhead.
Thank you, Madam Mayor, and thank you, Dr. Sikora, for that update. Just a question. Hopefully you can give some sort of a timeline on this. Can you just, how close are we to a vaccination for those under 12?
Oh, thank you very much, Councillor Broad. I can't give you a particular time frame on that. Within the Canadian context, vaccine manufacturers would follow the usual process, which is to make an application to Health Canada for review of safety and efficacy. Those are the two primary things that Health Canada looks at. Then normally what would be undertaken is the National Advisory Committee for Immunization would take that information and make a recommendation for use within a particular population group. And then the provinces themselves make independent and individual recommendations within their particular jurisdiction. From what we've seen over our COVID-19 experience over the past year, Health Canada does their appropriate job. You can't rush baking a cake is one of the phrases that I heard at the beginning of this. Their primary mandate is safety and efficacy, and we will not trade that for timeliness. So they will do their proper job of assessment. What we've seen is that once Health Canada does that safety and efficacy review, the rest of the federal governments and the provincial governments and provincial entities are able to quickly and very efficiently take those recommendations and implement locally. I know within our Alberta context, we are expecting an approval at some point, and have already given thoughts as to how we would implement this within the greater Alberta environment. So it's already back of mind, and we're already working on it. I certainly hope that it's sometime this year, but I can't say what the speed or what the speed will be of Health Canada.
I appreciate that. It's a bit of a personal question. I got 5 grandkids and they're all under 12. So that's just my own personal question. Thanks for that.
My 2 daughters are under 12. I'm interested as well. We're all very interested.
All right. Thank you.
Councillor Mackay.
Thank you, Dr. Sikora. Thank you, Percy. If I missed this, I apologize. So in today's announcements, so obviously we have a start time, 8 a.m. tomorrow. Do we have any information as to what triggers the removal of the restrictions?
At this point, there's no indication of what removes them.
So we don't, they're not tied to anything like as in, I guess the previous provincial mask mandate was tied to a number of vaccinations achieved. This one, we haven't got any information as to what would remove the restrictions.
Without the order in place, and Marta could really speak to that, without the legal aspects, there really is, we don't know.
All right, that was just my question. Thanks.
All right. Anyone else? Oh, go ahead, Councillor Watkins.
Yes, my questions are kind of more general questions. Maybe you could just explain, Dr. Sikora, herd immunity and just where are we at in that stage in province of Alberta?
Oh, that's far from a simple question, Councillor Watkins.
What's it what is herd immunity? Does that mean when we have like 80% of the population who have had it or have been vaccinated and or had it?
I can't put a specific number on it, and that's the tricky part of it. What really defines herd immunity is the vaccine it's the percent of protected individuals within a population which is sufficiently high to allow no further spread of a communicable disease. Which means if you have a group of, say, 1,000 people that have, and you all of a sudden have one single person in there that's infected, what level of protection do you have to have in that group of 1,000 to not allow spread of disease?
Okay.
The reason why it's challenging is the virus is changing. And we've seen with the advent of Delta variant, a virus that transmits more easily from person to person, as in, whereas in perhaps a year ago, in a completely unprotected population, for each new case, you might get 2 cases. You might, with the Delta variant, in a completely unprotected population, for each new case, you might get 4 cases. So that herd immunity level, that level of immunization that's needed to be able to ensure no further propagation of that communicable disease, that percentage just keeps getting higher and higher and higher. So I don't know what that level is or will be or will have to be for COVID-19, which is the reason why we have to constantly push on the immunization front as one of those critical measures to help stop spread, because, well, less illness overall and more of a protected population is definitely good. And then we're also working on those other suites of service, in those other tools in that suite of services to help reduce transmission events. The hand hygiene, the safe for work, safe for play, safe for learning, the face covering, the no touching the eyes and the mouth. So all of those things are critical to help reduce what those transmission probabilities are, those transmission chances are, and ultimately keep our population healthy.
And then with the Delta variant, I know it's more contagious, but is it more fatal, or where are we at with mortality rates in general, I guess, with the disease? Are they going down or sideways or what?
Great question. So what we know about Delta variant is that it being a variant of concern, it's more transmissible from person to person, not necessarily more fatal. So COVID-19 is and can be a fatal illness for many. Worse as you're older. So the over 60 population is exceptionally at risk, whereas the 6 to 16, well, the severe outcome, namely death, maybe isn't as bad, or isn't as likely there. That being said, we want to be able to prevent illness as much as we possibly can, because we also know that even if you do recover from COVID-19, or we know that even if you get COVID-19 and don't have that severe outcome, you still may be left with the post-COVID present, the long COVID syndromes, or those long COVID symptoms, tiredness, fatigue, headache, shortness of breath, some difficulty in their breathing. And if we can actually stop people from being infected, then we're also helping save them and protect them from having that long COVID illness or the long COVID syndromes.
Thank you. And then just one final question. It's probably another kind of simple question, but endemic versus pandemic. Simple definition.
So pandemic, usually something that might be newer and spreading very fast in a population, and more endemic being something that grumbles along over time and over geography. Now, I think with high enough immunization rates, with sufficiently good controls in terms of stopping transmission, we should be able to get to a point where, well, we still might be having cases of COVID-19 pop up over the year, over the next several months. But we just need to be able to help stop those transmission events in the very immediate future so that we can continue to have the critical care and hospital capacity to be able to care for everyone.
Okay, thank you. Thank you. Those are my questions, Madam Mayor.
Councillor Hughes.
Thank you. In the case of hospital admissions, can you share what the standard protocol is if they're in the hospital, and also what standard protocol will be different if they're in the ICU?
So can you elaborate on your question a bit?
So I'm just assuming that if someone goes into the hospital for COVID, that there's a standard of like, how do we typically handle it? I'm assuming they're going in for shortness of breath or some, I'm not quite sure what would qualify somebody to be needed to go to be hospitalized? And then once they are, what they should expect to have happened to them for treatment?
Oh, it's difficult to describe a typical experience.
Okay.
So individuals that do present with difficulty breathing, symptoms that would be associated with COVID-19, may mimic a whole host of other things. Typically, it's a respiratory complaint or respiratory concern overall. In hospital environments, in our emergency rooms, we use PPE, or we use infection prevention and control measures to help safely care for individuals, help protect our staff, and help protect others. A thorough assessment of their body systems, lungs included, is of course one of the primary things that has to be done. We do swabs and testing to quickly identify is this COVID-19, but we first and foremost support the individual. If there are symptoms that warrant respiratory support, as in intubation and being hooked up to a ventilator, that if necessary is quickly identified, and then critical care individuals that are critical care groups would be engaged at that point in time. Now, of course, that might be the extreme end of the spectrum, and there's a whole host of other things that can be undertaken in the interim. The specific treatments that are utilized are very much directed towards the individual and in consultation with the most responsible physician and care teams. What we have done over the course of the pandemic is work very carefully and very strongly with our critical care and internal medicine specialists in a scientific advisory group to be able to help identify, for Alberta context, what the protocols are for care of COVID-19 patients, all the way from that the critical care use, the use of inpatient medicine, including the aspects of primary care, and our specialist groups are also involved in the post-COVID and the after and the recovery phases of this as well. So we have taken very a great many strides in terms of being able to care for the entire patient along their entire journey of COVID-19 itself.
All right. Any more questions for either Dr. Sikora or Percy? How about Kevin? Go ahead, Councillor Mackay.
Yeah, thanks. Yeah, thanks. Since you broadened it out, and I guess the devil will be in the details, as we always have found once the orders come out. But Percy, I guess, what does this have any obvious impacts or immediate impacts in relation to either voting in the federal election or upcoming municipal election around sites? I don't anticipate there being any, but right now there's no requirement to show proof of vaccination or like to access facilities in Alberta at least, but is there any other possible implications?
I'll jump in here, Percy. So I can't really speak to the federal election measures, but for the municipal election, we had contingency planning for a pandemic type municipal election, but that's now come to the forefront in the last week. We're planning for that. So, at that point, it was really about spacing and sanitizing and that sort of thing. But certainly, if there's a masking requirement in place, then that will be incorporating that into the process as well. But I think definitely, voting in the municipal election, residents can at minimum expect to have to physically distance and that sort of thing, and perhaps wear a mask depending what time it is.
All right, I appreciate the answer. I'm just was wondering, based on these things will be in front of people's thoughts going forward, I'm sure. So thanks a lot.
Good question. All right, I'm seeing no more questions. And although we were provided with a bylaw, I don't think we're going to go there today. No need. So is there anything else, Percy, that you want to mention before we adjourn?
No, that's it. We brought you information, and it's nice having Dr. Sikora here being able to answer your questions.
Yeah, we do appreciate that. So thank you for coming, Dr. Sikora. And to Kevin your staff, it's Friday, long weekend. And you're going to be waiting now patiently. Marta will be reading a public health order sometime this weekend. So thank you for what you're going to be doing to get the signage up and the communications on the website appropriate. Except I know it's going to be busy for you, so thank you.
Mayor, can I just ask when we expect the order to be available? Does anybody know that?
That'll be the $1 million question.
Okay.
I think, in
I
terms of
figured.
things, we've seen orders as far as 3 days after the the publicly announced implementation date.
So as far as our city goes, I guess to Mr. Scobel, if we don't see this thing until Tuesday, let's say, because it's a long weekend, does your staff kind of wait till then, or do we just make some assumptions and go ahead and do the signs and all the rest of it?
So we're proceeding with the signage. Certainly we'll be reminding patrons that masks are required and that sort of thing. I think it's important to note, and I think we had our officer in charge and Aaron on here as well. From my understanding, there's no enforcement mechanisms in place at the moment either. So, they need some direction on that. So I don't know, perhaps Ryan or Aaron can comment on that a little further.
Yeah, thank you, Kevin. I'll just jump in on that. Yeah, so for the order itself, we have no indication right now that community peace officers will have the ability to enforce it. So we're just kind of waiting for that to see if there's going to be any follow-up announcement related to enforcement. So it will be left up to public health and the police agencies of jurisdiction to do that enforcement. The fines for, last I had heard for the fines for the public health measures, it increased from $1,200 to $2,400 per offense. So I suspect that unless the order says something different, I suspect that's going to be the same going forward.
And we've received now no direction from the RCMP based on this latest announcement today.
And I guess my message to the public would be that this weekend might be confusing, whether we're wearing masks while we're working out, while we're not. So I would just ask that while we allow our staff the time to sift through whatever orders come out in the next couple of days, we are respectful of the staff of the city of St. Albert and just really ask for patience because everyone is struggling with this at different levels. So let's try to show the world how great St. Albert can be. All right. Councillor Bride, do you have a request to motion pushed? Are you making it a motion to adjourn? Okay. Okay.
Yeah, I'll just move the recommended motion that the COVID-19 update be received as information.
All right. Anything to add?
No, Madam Mayor.
Okay. Anyone else? All right. I'll call for the vote. I'm assuming that's unanimous. All right. Would you like to make a motion to adjourn, Councillor Mackay?
No, you guys it's all falling apart now that I'm not there to guide you. So I will just leave.
Meeting adjourned. See you guys later.